Good morning, my lovelies. So I know I was going to do another segment on my certification. However, I feel like I need to do a PSA. So I've had several clients who have come to the office who are looking to have Botox done again. They went to several other places where they've had it done. And when I, talk to them about their injections, they let me know how many units they had. Some of them actually bring their paperwork in. So I just think it's imperative that you realize how your injections should be and how they need to safely be administered. So one of the biggest ones that I get is the 11s right here. Obviously, nobody likes it. It's deeper. This is the one that, most people want to fix. So one of my most recent clients came in and they said they went in and they had 20 units injected in one spot. And the paperwork that they brought also said the same thing. So the issue that I have with this is that, yes, you can do 20 units in this area, but it needs to be 4 units each. So it needs to be 4 units here, 4 units here, 4 here, 4 here, and 4 here. The reason is if you put 20 units in one area, you're not fixing the entire muscle that is contributing to that 11 that you have right there. Another thing is she went back 2 weeks later and she had 6 more units put into her forehead. So the issue that I have with that is it's helpful, yes, but if you are not treating this area and this area, so when you no longer have the ability to move that, you cause this muscle to work harder, which is why you start developing lines on your forehead. So they put 1 unit in 6 different spots, and she had this injection done in December, but it's April. And she had it done at the end of December and it's April. And when I asked her how long it lasted, she told me like it was starting to come back in February, the end of February, where she was able to move her muscles. So to me, what that says is that it was diluted too much and not enough was used. So it's imperative that you understand Botox injections for your own safety because Botox is not cheap. And it's something that should last you a good amount of time. A good injector can make Botox last 6 months. Sometimes it can last longer. Sometimes it lasts less. One of the reasons why it lasts less is if you exercise, then it causes it to speed up the metabolism in your body, which breaks it down faster, which is why it only lasts for about 4 months. So when I talked to this person, they told me that they don't exercise, they don't like to exercise, they don't go on walks or anything like that. So there is no reason why this injection should have lasted only 2 months unless 1, it was not diluted correctly, 2, it definitively was not injected correctly, and it wasn't the correct amounts to be injected. So I think it's important that you know exactly how many units should be injected into each area. And if they say 20 units does not mean just 20 units in one location. It is spread over the entire muscle that causes those 11s. So for the frontalis muscle, it needs to be 2 to 4 units on each site, 10 to 40 units. 40 units being max, and it needs to be injected symmetrically. So that's another thing that, I've had people talk to me about, they've had like 1 unit here and like 1 unit here, which it needs to be between 2 and 4 units on a good injector. You don't want 2 units here and then 2 units here or 2 units here and 2. It needs to be symmetrical across the face. And that's going to help with these forehead lines that we develop. And if you're not doing it symmetrically, you're going to end up with one side not using those muscles and then the other side overcompensating. So it's very important that when you go to your injector that you talk to them and you make sure that they know that they're doing this correctly. And if you go in and they say we need to inject 20 units, in your corrugator right here, then ask them, are you injecting 20 units directly into that, or are you spreading it across the face? And they go, just 20 units here. I would stop the treatment. I wouldn't accept it, because you're not doing anything except just flushing your money down the toilet. And like I said, I know Botox is not cheap. I know fillers are not cheap. I know aesthetics is not cheap. And you should be getting what you pay for. And, a wise person once said to me, are you really going to go and trust your face to someone who advertises on a billboard for $8.99 a unit for Botox? Or are you going to go to somebody who may charge a little bit more? Like me, I charge a little bit more than $8.99, but knows what they're doing and is going to make sure that you're treated well and that you're taking care of your face. So I've started telling people, and, this holds true, is that, I might not be the cheapest place around, but if the reason, why you're shopping is based on price, then I'm probably not the right place for you to go, because I don't do the cheapest Botox. I refuse to do the cheapest of any treatment, because I take my time with my clients. I make sure that I have the knowledge to do it correctly. I don't over dilute, because if you over dilute, you get more units out of each vial, but you also have results that don't last and they don't work like they're supposed to. And I'm a big advocate for making sure that you're getting what you're paying for. So yes, my per unit or per area might cost more, but at least with me, your units of Botox are not diluted. I'm using the FDA guidelines, regulations for how I dilute that. And I talked about that on a previous video, but it just pains me to see that I still have clients coming in who are going to places and they're telling me, yep, they injected 20 units right here, and they injected 1 unit over here, which you're not supposed to go over the midline of your eye. That's what causes like brow ptosis. So if you are considering Botox, make sure you ask the questions. It's very important. How many units are you injecting? What sites are you injecting in? And what is your dilution rate? And if you're not comfortable, do not have the treatment. Find somebody that is going to be open, honest, and transparent with you. And if you go in and ask for their certification, ask to see where their certification is, of where they were certified to be able to inject Botox, because maybe they weren't certified. Maybe they're working underneath someone else's license and they were the one who showed them how to inject Botox, and maybe they weren't trained properly. You never know. But you should see a certification for the person who is injecting you, and it should have their name and their title on it. So that's kind of my PSA for today, because I'm very passionate about what I do, and it just bothers me a lot when I have clients that come in here and they tell me these stories and they show me the papers of where they went that actually shows that yes, they injected 20 units in one spot. And any injector that is worth their weight in gold will tell you you're not supposed to inject more than 4 units per site, especially for like Botox, which is what I use, which is what I always talk about. Like I said, there's other ones that I don't use, so I can't speak to them, but I can look back to my material that I have. And there is one that you can use 10 units on, but this was not what this person was having injected. They were having Botox or Dysport, which is the exact same for indications from the FDA. So please, 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 if you're gonna have Botox or anything done aesthetically, especially to your face, make sure you ask those questions and you see a certification. So I'm gonna let you go with that, and I will have more TikToks to come. I'm working on them now, so have a great, grand, wonderful day. See you later.